I got two slightly related questions here. One from Matthew Davis. Matthew, hello, welcome again. Could you outline any adverse reactions to laser in the patient themselves? You talked about the goggles and so on.
Yeah.
But, what could go wrong? What can we do?
You could. There's a thing called the Arent-Schultz law, which is a bit wishy-washy, but it says that if you overtreat someone, you shouldn't cause damage, but you'll just get no benefit whatsoever. So there is an optimization of how much energy a tissue requires. And although you may be overtreating the skin surface area, it should be fine lower down. But inevitably, depending on spot size and the power density, if you're using a laser which is a powerful laser with a small spot size, you could damage the skin.
Burn it.
You could burn it, yeah. And I have a slide here which might illustrate that a little bit better. So, oops, sorry. If I show you this slide here, what this slide is trying to illustrate, and your audience can see that, is on the x-axis it's about time exposure, and on the y-axis you've got the irradiance, the amount of power per centimetre squared. And what that line shows you on the bottom right corner is if you have a relatively long time frame without a lot of power, you get a therapy laser. Yeah. But still using an 800 nanometer beam, if you decide to go and reduce the time and increase the power, you can actually end up becoming a surgical laser.
Okay. Can we keep the slide up, please?
And if you go further and further over, you can actually ablate tissue. So on these FDA CE markings, we have to prove...
Sorry, can we keep the slide up, please?
We have to prove safety, and that within the parameters of a laser that's allowed to be used for therapy, we are in this therapeutic zone and not obviously getting to the surgical zone. But changing the spot size and changing the power or the time it's on can have that detrimental effect, Hence, only selling it into the medical profession.
So, in terms of what the patient will experience, are they just going to say, this is feeling a bit hot now on my arm, thumb, whatever?
Yeah, I mean, Andy will have experience of this, but one of the positive placebo effects of a good therapy laser, and especially the class 4 lasers, is there is quite a lot of heat generated there. But that's not a bad thing in regards of, one, the patient feeling like something's happened to them there and then, rather than over a long period of time. But in regards of, Andy and other clinicians using it, it helps them before the manipulations, which could be quite a painful manipulation, actually to be able to do more within the session if they treat them prior to it. And if there is a placebo effect, it's the actual warming effect that it does within that tissue.
Yeah, I think most people would say that they feel it warm, not hot. I've never had anybody that would feel it hot. I think really the only time that we would be at the risk of making it feel hot is if you left it on for too long. Sometimes people might feel a little bit the morning after, if it's a shoulder or an elbow. Then sometimes people feel it's a little bit stiff until it gets going. Sometimes people will feel that it feels a little bit sore, but really very rarely more than that.
And very occasionally, especially with the really chronic fibromyalgia patients that we treat, we actually have to tone down the power because their their abnormal pain sensation within the parameters that we're calibrating, and obviously it's for the average person, is not average for that person. And therefore sometimes we actually have to tone down our laser before we start ramping it up as the person progresses. So we have anaesthetists and pain clinicians using it, and their initial thing is actually to go to the lowest setting and then gradually work their way up again.
And if you don't do that with a fibromyalgia patient, what will they
well, they'll tell you. They'll feel a sort of a prickling sensation, which an average person wouldn't get. And therefore, because of the chronic pain syndromes and all the other maladaptive pain that the individual is feeling, sometimes you need to work your way down. We actually did a study on peripheral nerves. So again, we did a study on 70 females, and this was with chronic peripheral neuropathies. And if I show you this, we actually went and treated their lumbosacral area and the lower limb. and it was a double-blind RCT crossover study. And there was a very significant improvement in the patients who were treated, in this case with K-laser, compared to the placebo group, both on the crossover and the blinded side of it.